Dr. David Navarro, just giving an idea of the scale of the operation we are all involved in. Today's second dialogue, all part of that. And let me introduce our first panel to you now. And remember to send in your comments and questions so that you are part of this conversation. With me here in our studio is Professor Alice Stanton. She's Professor in Cardiovascular Pharmacology at the Royal College of Surgeons, and she's a member of Ireland's 2030 Agri-Food Strategy Committee. Sharon Buckley is the Chief Commercial Officer with Musgraves, which has been keeping shops stocked and people fed for many years. And Sharon is also responsible for Musgrave's sustainability agenda. Professor Dónal O'Shea is known to many of you. He's the HSE National Lead on Obesity, and he's done extensive work on the prevention of obesity. And JP McMahon is, as my aunties used to say, a legend in his own lifetime. He's a renowned chef, restaurateur and author, and the founder of the Food on the Edge and the Galway Food Festivals, and we look forward to hearing from all of you. Are we going to have a look at the result of that first Slido poll? Do we have that result in yet? Yes, there we go. So the question I asked you before we started, and I just thought we'd give your poll results to the panel to kick off with. What's the most important consideration for you watching us and joining us today when you're buying food? And on 3% it was the carbon footprint. On 5% it was the amount of packaging. Interesting, because we hear an awful lot about that these days. On 5% as well, whether it's organic, so again quite a small number there. Price matters most to 12%. Taste matters most to 25%. But really interesting here, and Professor Alice Stanton, maybe you'd respond to this, the fact that nutritional value is the most important consideration for 30% of the people with us today when they're buying food. What does that tell you as we talk about the change we're trying to bring about in the food industry?
I think it's very encouraging that nutritional value is regarded as so important. I'm a little bit disappointed that the carbon footprint is so low. Quality assurance and safety of food is up pretty high, and taste is high. I think we need to bear all of those factors in mind. I don't think we're communicating well enough currently about nutritional value. I think a lot of people are familiar with the traffic light system, which really highlights the disadvantageous ingredients of our food. So the salt, the sugar, the excess of calories, the saturated fat. In fact, that probably should be added trans fats rather than saturated fats. We're actually learning...
Yes, again, because there's different breakdowns within that.
We're learning more and more about that. However, the really important thing is that we are not highlighting the beneficial ingredients. So the vitamins and minerals, the essential amino acids, the essential omega-3 fatty acids that are present in natural whole food. So natural whole fruits and whole vegetables and whole animal source foods. So the meat, dairy, eggs and oily fish that we need to be eating in moderation, in the correct proportions. And we really aren't getting that across on the front of pack labels. But I am encouraged that people are valuing nutritional value and nutritional content. I think we need to improve on that.
Okay. But Dónal O'Shea, the thing I often wonder is in many ways it's not for want of trying. I mean, if you look at the primary school programme and the messaging that goes to children there, and there's a huge amount of work that goes on. And then the experience of many people is, busy lifestyles. You get, half your kids go vegan and they won't eat anything if it doesn't come in a bought-in salad from the shop because they won't eat home cooking anymore. The fellas all want, everything with chili sauce all over it. And so people fall into these habits. They feel that, but they have all been taught, an awful lot of the right messages early on. So from your point of view, in selling this message, what are we getting wrong? What do you think, following on from Alice Stanton, is going wrong at the moment? And how do we help people change? Because the whole idea of this is less talk and more real change.
Yeah, I think we do need we need real change. We have reached a point where what we are eating and the pattern of our food consumption and drink consumption is the biggest driver of disease that we have. And that's an extraordinary point to have reached. Education is the key. I think the answer to that first question around nutritional value speaks to the audience that would join a food systems summit. And I think when you look at multi-stakeholder engagement, we absolutely have to reach to where the problem is at its greatest, and that's in the less well-off parts of our society. And I think food labeling is important, but I think the key is going to be around the marketing and promotion of the high fat, high salt, high sugar foods in a very targeted way to those who are most likely to struggle with their weight. And I think that is the key. And when we have had an obesity and overweight model of care approved in this country recently, so we're going to start actively treating overweight and obesity in Ireland in the next number of years. And that's going to end up being like, what happened when we started to treat lung cancer and heart disease. The role of cigarettes in driving those was actively targeted. And we have to do the same with our approach to managing overweight and obesity, and really energize the battle against the promotion and marketing of high fat, high salt, high sugar foods to those most at risk.
That's a stunning statement about our food, our diets, driving the diseases that we suffer from. And actually, I've got another Slido poll question I want people to join in on now, and it speaks to this. To what extent should public policy dictate people's diet? Should it be 100%, 75%, 50%, 25%, or 0%? Should the state butt out and let people eat what they want willy-nilly? And in terms of that first poll result, Sharon, I want to come to you in Musgraves, because one of the questions that has come in from Chris is, with food retailers being in many senses winners during the pandemic, we all came to realise how much we need our local supermarket and our local shops. Shouldn't they take the lead and offer more incentives for shoppers to buy organic and sustainable food, which was only 5% in our poll there? What do you think?
Well, I think we've seen a big change in, I suppose, people's approach to health over the last number of years. We're certainly seeing consumers become much more interested in healthy foods and healthy diets. And actually through COVID itself, we've seen some quite dramatic shifts as well. So a number of years ago, it was probably about superfoods and the health food aisle, and less about a kind of holistic approach to healthy food and diets. And we certainly see that change, as I say, during COVID. Our most recent consumer research shows that consumers have really valued, I suppose, getting back to basics over the last 15 months. Things like cooking from scratch, buying local produce, really getting back to kind of basic diets as well in terms of fruit and veg and meat and I suppose components of diet that Alice spoke to at the beginning. And I think we have a role certainly as retailers in encouraging that and in making kind of fresh, natural foods really available to consumers, driving things like local foods harder and promoting them in terms of promotions, price, accessibility, and also areas like convenience. So you spoke, Anya, about lifestyles and busy people, etc. And I think, as I say, people have gone back to basics and really valued the role of food in healthy diets and in their overall well-being. But they also, I suppose, are kind of sick of cooking from scratch. So we're seeing more recently, people looking for convenient foods. And I think our job as retailers is to make the healthier choices the more accessible and convenient choice. So, for example, in SuperValue, we would have introduced programs like Prepared by a Butcher or Prepared by a Fishmonger, which is making basic healthy foods just much more convenient. So it's, meat and 2 veg in a tray that you put in the oven, or it's fish in a bag with sauce that you can microwave. So it's taking some of those challenges around things like cooking, things like budgeting as well. So you can maybe buy 2 dinners for €10 and making it, as I say, easy and accessible for people to have basic, wholesome, nutritious food every day. I think organic is an interesting factor, but it still represents, the minority of sales in Ireland. I think people have trust in mainstream fruit and veg and mainstream meat, etc., in this country, where the quality and the standards of production are really high. So while organic food is important, I think it's more about mass market, mainstream, wholesome, natural foods, and with, as I say, with a particular emphasis on local.
JP McMahon, we heard David Nabarro talking there about COVID and its impact on food worldwide. It's been a dreadful year, an annus horribilis for many people involved in the food industry in Ireland at the hospitality end. You'd be aware of that. Again, what Sharon was talking about, we all went home, we made our banana bread, our sourdough, we had time to cook from scratch. Now people trying to pick up the threads again. So what are your thoughts about this past year? What lessons should we take forward in trying to, if you like, build back better in our agri-food industry, particularly from your point of view?
I think the first 2 points. One would be, I think community is a very important part of what we do, and working with a local community of whether it's suppliers or farmers, and trying to build, I suppose, a real food system, one that is dependent on people, where you meet people through the food system, as opposed to you're just dealing with food products and as a commodity. I think the other one, and Dónal mentioned this, is education. I think education is really key. I think there's a lack of transparency in our food systems. I mean, really, I think, and this is probably something both for the panel and for the whole summit, is that, like, I mean, sustainable is not a word that is defined equally, and I would question its use in many practices, even in the case of restaurants. I also think, with regards to nutrition versus organic, and that I think many of the things that we stigmatize in relation to obesity, whether it's fat, salt, and sugar, are the building blocks of food and of life itself. So I think, as a chef, I think we need to be very careful about how we communicate this, because I am for teaching people how to cook. I have 110 kids in a cooking class, a Zoom cooking class at the moment, and it's about respecting ingredients, knowing where they come from, knowing the value of those ingredients, knowing what produces taste and what doesn't produce taste. But I've never reduced food to just its nutritional value. And I think you mentioned the European traffic light system, or Anya did. I think there's a lot of problems with that, because it values some processed foods over some whole foods because of their salt, fat, or sugar intake. Take, for example, like Serrano ham or prosciutto, that might have a higher salt content. So I'd be concerned about them. I hope going forward that people return to restaurants, but retain the values that they learned over the last year, and many values I learned myself. I mean, I don't cook at home an awful lot because I'm cooking in the restaurant 5 days a week. So it was enlightening for me to cook a lot more at home and cook domestically. And I think that domestic space is very, very important for us Irish people, because we still have a very good connection with the land, and we can't overlook that fact, because many countries, whether it's the US or whether it's some of the bigger cities in England, they have lost that connection to the land and knowing where food comes from.
And I think, actually, Sharon, maybe you take this point. Isn't it important? Because, again, this is an argument, whatever about organic versus non-organic. That point that JP was making about community. So it's about what's local. And, in a pandemic, what's local became very important to all of us. We all became very aware, between COVID and Brexit, of supply lines and how they can be stretched. So again, if we're trying to educate people, if we're trying to, focus on nutrition and health, doesn't that mean emphasising what's local, what's got a low carbon footprint in getting to you, and what, because it's freshest, is likely to have a much higher nutritional value than something that's been flown from the other side of the world? So how do we change that messaging?
Yes, I couldn't agree with you more. I think, as I say, people really did come to value local food over the last year, and I think recognise, as you say, what is actually truly local as well. And people had different maybe perceptions of where product came from, but have become more knowledgeable and more interested and deliberately informing themselves better on local food over that period. It is interesting in research, as I say as well, consumers do see local food as being more nutritious, and that whole, I suppose, wanting to support local communities, not just in terms of economic vibrancy of local communities and local producers, but also the whole sustainability agenda is really coming to the fore, as everyone is speaking about. And while the sustainability agenda is very broad, and obviously packaging, and it didn't come out in the poll, but packaging is certainly up in lights with consumers, a lot of it is about the holistic sustainability agenda, low food miles, low carbon footprint, and then connecting that with the kind of economic and social viability of communities, particularly in rural Ireland. So I think that is the emphasis that we should take going forward. It is something that consumers want, as I say, on a multitude of, or based on a multitude of factors, and certainly there's an opportunity to further grow that over the years to come. I think one of the things that we have done over the last number of years in SuperValue is a programme called Food Academy, which is about nurturing small local suppliers and helping them to grow and expand. And the Happy Pear, for example, who you would know is very successful, started on that programme with us. So it has the capacity to, really grow suppliers if their product resonates with consumers, and they have that ambition. And I think programs like that and other retailers running them as well, I think can really help the vibrancy of the whole small and local production sector into the future. And certainly as retailers, we certainly we kind of accept our responsibility and an opportunity here in terms of really giving consumers what they want.
Dónal, a question has come in. Does there need to be an increased focus on nutrition as part of medical training? So do the doctors need to learn more about this? And should GPs be more central to tackling issues around weight? And it's, there are a lot of sensitivities around this now, in terms of, you don't want to be giving kids, making them prone to an eating disorder or making them feel stigmatized. So how do we have these discussions? How do we educate people?
Well, I think you educate people, or you have the discussion by making it routine to record an individual's weight and height. And the new GP contract in Ireland incorporates health checks at the age of 2 and 5, and as it's expanded, will go into kind of adolescence, where weight and height will be recorded. And with any disease, it's about early identification and then do something. Because by the time a child has significant, appears to have a weight problem, that weight problem is extreme and it's difficult to do something about. So unless you're weighing and measuring routinely and then able to have the discussion in a non-stigmatized manner with the parents to point out that, look, the child's weight growth is ahead of their height growth. So if you can keep the weight steady, a child will grow into their weight, if you like, in a healthy way. You obviously don't have that chance as an adult, but in adults, there is going to be routine weighing and measuring of height and weight when you go for a GP checkup as part of the new contract. And there is a plan to recruit over 100 dietitians now to deliver a combination of diabetes prevention and weight management programs in the community. So GPs will now have somewhere to signpost an individual for, if you like, more active and appropriate management of their weight. And the majority of patients still coming to our clinic in Loughlinstown, which is still kind of the main clinic for people with severe and complex obesity, have never seen a dietitian. They've never actually, they're coming to us and that's the first thing we're doing, is arranging a review of their approach to nutrition. What we understand now, though, is that treatment is different to prevention. So when you have the disease of obesity, eat less, move more is not the treatment. We do not tell somebody with skin cancer, melanoma, because they have a genetic predisposition and they got too much sun exposure. We don't tell them to put on sun cream and wear a hat. Whereas that's prevention. We are still telling people with obesity to eat less and move more. And that is not the treatment for obesity. You have to have drug therapy and you have to have surgery if necessary. And that attitude is changing slowly within the medical profession, and the realization is dawning. And I think the COVID-19 pandemic, as Dr. Navarro alluded to when he said climate, conflict, and COVID as the three kind of triple C's, COVID-19 and obesity has collided, and it's been called a syndemic because you have absolutely really poor outcomes in people living with obesity who contracted COVID. So everyone is sitting up and saying, look, obesity is a chronic disease, we must treat it, and therefore we have to incorporate more aggressive education into our undergraduate curriculum across medicine, nursing, physio, and then we've got to get everyone detecting early so we can intervene.
And JP, you mentioned, and one of the things that many chefs like yourself did as part of the lockdown pivot was to move online. And, the popularity of all those, for instance, the kids' classes. So in terms of educating children, because on one level, we watch television, food television more than we ever did in all our lives before. Food is talked about. There's almost an element of food pornography sometimes, you might say. And yet, on the other hand, there are these huge gaps that we've been hearing about from the other panellists in terms of nutrition and also in terms of equality. So what are you trying to teach about food to a new generation?
Yeah, I think more than ever before, there are more cookbooks produced and more TV programs about food produced, and yet people are eating worse and cooking less. And I suppose what I try and do is to try and teach people the basic value of food. And what I mean by that is the basic building blocks of making a dish, whether it's something simple as like bolognese or cauliflower and cheese or lasagna or all these things. Like nutritious dishes that you can communicate where a certain product comes from, where a certain food comes from, tie it into culture. So for me, I'm always trying to make food a cultural experience. And I think that's something that we miss. I think it's something that we really miss in Ireland. Possibly Italians or Spanish or French understand a bit more. But food as a cultural experience is really important for me. And that's why I value the nutritional aspect of it, and I value other aspects of it. But I think we need to talk about it and enjoy it as much as we enjoy the theatre or anything else that we do really well, like sports in this country. But I was amazed, really. We've done classes for adults as well, but the kids ones were the most oversubscribed ones. So I think there is a hunger there for education, and I would love to see. And I and many others, such as Dónal, have talked about this for many years, like a kid's food subject. And I'm not talking about a cooking subject in primary school. I'm talking about a food subject that we would study food in the way we study math or English, because we eat 3 times a day, and we kind of pawn it off to the parents most of the time to will the children eat well, but we don't expect the parents to teach our children math or many other things. So I hope in the future there is some subject that will take in all of these different avenues of food, such as nutrition and culture and other things. That's what I hope.
That's a great idea, food as a subject in schools. And on that thing about, valuing our own terroir, I always think, if Italians had our new potatoes, there'd be, potato festivals happening all over the country, the way that they celebrate their local produce in Italy. I want to give you a correction to the poll question. The percentages, were they a little bit confusing? So I'll give you the question again, and hopefully this time it will be clearer. So to what extent should public policy shape people's diet? Very much speaking to what we're talking about today. So you could choose the people's diets should be strictly regulated by government. Dietary advice should be given but more prominently than now. Dietary information should only be there for those who want it, or not at all. In other words, people should be free to eat what they want and do what they want, and it's none of the state businesses. But even in terms of the percentages, 81% saying, this is really interesting, isn't it, Alice? 81% dietary advice should be given, but more prominently than now. So that messaging, like JP was talking about, perhaps we could put food as a subject in schools for people to learn about it properly, and also to learn, you know, because as Sharon was saying, the busy lives, people don't always have the time or even the skill set to work from scratch.
I think JP's suggestion of food as a subject would be great in either primary or secondary school or both. And in fact, there was a really interesting project conducted in the primary schools surrounding Derry, where they looked at both education concerning food and the food environment, what you surrounded the children with, what snacks you provided, experience during cooking classes. And in actual fact, for both knowledge and practice of eating sensibly and healthfully, both were important. So both the education, what you say to the kids, but also the actual environment that you surround them with. If you say one thing and then actually the teachers and parents
dispenser outside the door and packets of crisps and the lunch packs. Yeah.
It is not as good. And in actual fact, they also tested mental health and concentration of the children who got both the education and the environment, either or the combination. And the combination was best for mental health and concentration during school. So there are considerable benefits to more education and improving actually the experience of eating for children in particular, but for all of us.
And Dónal, do you also endorse that idea of food as a subject, particularly what you're saying about the way that we need to educate not just the medical profession, but we need to change public attitudes, and people will be getting the information when they go to their GPs now about their weight?
Yeah, I think having a population leave school skilled in understanding food and its importance is essential. There is the Department of Education are very committed to that, and it's the how it's done, and it's the how. And I would love to think that would inform the discussion around this strategy and be a kind of an output from the consultation phase of this. How do we do that in Ireland? There's a wellbeing curriculum that's been introduced in secondary schools, 300 to 400 hours in the junior cycle. It's going to extend into the senior cycle, and nutrition coming into that, I think, would be fantastic. Could you, we give points for subjects, but points isn't the answer. No, building food into the curriculum in schools would be essential and could be transformative to our population health.
JP, just one thing before I go back to, if you like, the broader agenda. But I remember growing up, my mother very often couldn't afford to buy meat during the week, but she knew how to buy the scrag ends of the lamb, or she knew how to steep the hearts, and she knew, and I'm not saying we necessarily wanted to eat hearts, and I wouldn't recommend it to anybody, but there was a level of home cooking skill there. And Sharon was making the point about time, that knowledge and that time isn't there to make, if you like, the most economical use of food. So people are, if you like, pushed in the direction of needing, the cheap chicken in the supermarket or whatever, which, we're all trying to move away from. Your thoughts on that, given that we are now in the 21st century and hopefully picking up the threads of our lives in some kind of new post-pandemic normal?
Yeah, I would say to people, and I say this in the cooking classes, it's not a black and white situation in terms of cooking at home. We all live busy lives, and many homes are two parents working. I would always say, well, begin with one day. And if you can cook a meal on Saturday, but begin with one day and try and develop, get a recipe and buy stuff and engage with your environment, whether it's going to the local butchers or the fishmonger in the supermarket or whatever it is that you're talking to people about food, and then possibly do 2 days. And then most people don't even know that when you cook food, that you can keep it in your fridge for up to 48 hours, most foods, and then eat it over the next 2 days. I mean, that's the question that I get asked a lot, is how long is it going to last for, or does it freeze well? And so there are ways in which we can educate people to cook on a Saturday and actually just put it in their freezer, and then you'll have food for 7 days. And so I think these things are part of an agenda, a holistic agenda that we need. And we also, as we need to value food more. And that issue about price, which was high with nutrition, I think that also needs to be combated globally. There's no point in someone producing asparagus that can't even feed themselves, but the asparagus is being shipped off to Europe so we can buy cheap asparagus just so we'll have more money. I mean, that's a discrepancy that absolutely needs to be addressed going forward in this century. So I think that really needs to change. And Europe needs to be a guiding light on that, because most of the food that's being produced in the developed world is going to Europe. And you mentioned chicken there as well. I think really people don't understand the value of chicken. And even when we were growing up, chicken wasn't something you could consume every single day, even twice a day, whereas now it's very much standard practice.
Yeah, those are really good points, and Alice, that idea, just start with one day, or how people can use the weekend to provide, for more convenient solutions for healthier dinners during the week. It's campaigns like that that could show people the way. And will you also we've had a question in about institutions, about improving the food in canteens in institutions, and we've also heard a lot about hospital food as well. So how people at home can make the change, and the changes we need to make institutionally too.
Yeah, I think so. I think we've focused a fair amount on obesity, and it is a huge problem. Like, of the world's population of almost 8 billion, we now have 2 billion who are obese. We also have almost a billion.
A quarter of the world's population is obese.
That is the current position, and it's not just in the high-income countries. It also is impacting on the low, middle and low-income countries in Asia and in Africa. You can have a combination of starvation or undernutrition alongside, in a neighbouring house, obesity. And what's not known is the hidden hunger. We have a further 2 billion who are micronutrient deficient, who are not getting enough iron, enough selenium, enough iodine, enough vitamins. And that's even relevant to COVID-19. I think most of us have heard of the association of vitamin D deficiency in fighting the severity of COVID-19. But there's also evidence actually that multiple micronutrients are really important for the immune function. So coming back to your question, we need to educate people about the beneficial ingredients in a wide range of food. So you won't get those micronutrients in one food group alone. So you need to get it from the fruits, from the vegetables, from the fish, from the dairy. In fact, dairy, if you drink 2 portions of dairy a day at least, you're 20% less likely to die. So it's not just obesity that is causing deaths and illness worldwide. It is a huge problem, but we also have a hidden hunger both in the affluent and the less affluent. And in fact, it is the least advantaged within our community that are most likely to be eating those empty calories which promote both obesity and micronutrient deficiency. So a wide range of food, and yes, we do not need to be eating either red meat or chicken every day, or even twice a day, as some people are doing. But we do need to eat a wide range, eat some chicken, eat some red meat, definitely be eating more fruit and vegetables.
And obviously people make their own ethical choices in that regard. But Dónal O'Shea, the difficulty here is, the world is a very noisy place. So the messaging isn't just coming from people like yourselves. There are all kinds of choices now about milk. So that instead of drinking the milk we all grew up drinking, you could be drinking oat milk, or you could be drinking coconut milk. And there are ways, and there are lots of fads, there are lots of, or even choices, made in good ethical conscience and for good ethical reasons. But within that, say for instance, if you're embracing a vegan diet, you will need to be aware of nutrition and look at the way your diet is balanced. So in a noisy world, it can be difficult to communicate, can't it?
I think it's very difficult to communicate in the current environment. Fundamentally, and JP kind of referenced this, fat, sugar and salt are building blocks which are critical to survival, storing energy and taking energy in was the very primal if you like, thing that allows the individual single cell organism to survive to the next day, and evolution begins. So we need to respect our kind of the building blocks of food, and educate people that there is no such thing as a bad food. It's about proportion and portion. And in a noisy world where profit speaks louder than health, it is, the education piece is the key. And just to reference, if I could, back to the question about institutions, they are, if you like, environments where you can look at a microcosm of change. So the food environment within the prison setting, for example, is incredibly unhealthy. Unhealthier for prison officers than prisoners. Now, that's crazy. If you have proper procurement and if you have proper nutrition guidelines, then you should be able to regulate that environment and look at the impact on health in that microcosm of an institutional setting. And we need to do that. And countries that are small like Ireland can do that and show the rest of the world that actually if you introduce nutrition guidelines and procurement, a healthy procurement process, that you can change environment and influence health.
Besides the education that needs to be going on and the public messaging and things like, bringing food in much more in an integrated way as part of the school curriculum, Sharon, also talked to me about how we drive the change we need by retailers working with producers, particularly in terms of what you were saying about shopping local.
I think there's a lot that retailers can do on the broad sustainability agenda, of which shopping local and buying local products is a key component. But I think, and I was a member, or I am a member of the Agri-Food 2030 Strategy Committee as well, and obviously sustainability is at the core of that, but it is, again, sustainability on a really holistic basis. So I think as retailers, who interface with consumers on a daily basis, we probably understand very well what consumers want, where they're going to go next, and actually sharing that insight right through the supply chain back to the primary producers, so that they can focus their efforts on the right areas in terms of what consumers want, and also back the other way. So I think it's really important that retailers use their influence throughout the whole food supply chain to make food sustainable at all the steps along the way. So I think primary producers clearly have a big responsibility, but as we take food from the farm right through to the shelf, it is about making sure it's packaged appropriately, it's transported in the lowest, most efficient, lowest carbon, most efficient way, It's presented in stores again that operate sustainably, and we help consumers reduce food waste in the home and live as sustainably as possible as well. And I think retailers have a responsibility and I suppose an opportunity in that space to actually influence the whole food supply chain in the way maybe that others don't.
And Alice, that's where, you think of things we're missing, like the ploughing, Bloom, the food festivals that take place all over the country. JP will know all about it. They're having to move online. But the more we can tell people the story of food, that's another way, and we have to keep finding ways to tell the story of the food that is made here, what its value, and make, if you like, that nutrition message an easy one to absorb.
Yeah, I think the quality of Irish food, we need to emphasise that. We need to keep telling the story, and I think we need to be more optimistic about how we can improve the sustainability credentials of the food that we produce here in Ireland by linking with the farmers and by supporting them in their journey to sustainability, because we need food in order to survive, as Dónal has said.
But at the moment, we're killing
currently,
ourselves.
Food is producing emissions. It is possible, and indeed very much possible, that we can balance those emissions with carbon sequestration. And I was disappointed that only 3% of the audience were counting carbon footprint as being hugely important in their purchasing of food. I think that's going to increase, and I think that's among certain audiences, certainly the youth, that is much greater. But there's room for optimism. There are techniques and innovations that are being made ready at the moment and are starting to be implemented that can make our food production completely sustainable. So we can be and will be carbon neutral by 2050, and we will be halfway there by 2030.
Well, that's certainly something to look forward to, and it's always nice to have a note of optimism. To conclude a panel discussion, thank you so much, all of you, Alice, JP, Dónal and Sharon. I really enjoyed it. Thank you to all of you who joined in as well with your poll questions and the questions that you sent in.